Okay, good morning. Please let me know if you're able to hear me by just typing into the questions box. Beautiful. Okay, thank you so much, folks. We're going to go ahead and back up a couple of steps to make sure that everybody's set.
Okay, good morning, everyone, and welcome to today's webinar on the 2016 Benefits Tour. Before we get started, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. To the left is the GoToWebinar viewer through which you can see the presentation. To the right is the GoToWebinar control panel where you can ask questions and select audio mode. You're listening in using your computer's speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them after the UnitedHealthcare portion of the presentation and at the end of today's presentation. Let's try this step quickly one more time. Please use the questions pane to let me know if you're able to hear me. Great, thank you. It looks like we are ready for our session. I would now like to introduce our three presenters for today. Tom Keller, Director of Benefits, Gloria Laverne, UnitedHealthcare Field Account Manager, and Dan Comte, Coordinator of Total Rewards, who will be presenting our topic for today.
Thank you, Leah. I appreciate the introduction, and welcome you all to the webinar today, and I appreciate you all taking the time out of your busy schedules to join us. We want to start out just by talking a little bit about total rewards. For many of you, you may know that the Human Resources Department underwent a little bit of a reorganization a couple of years ago, and as part of the reorganization, the Total Rewards Department was formed. And that is what our benefits and total rewards team is made up of. So we wanted to talk a little bit about what total rewards is, because it is more than just your pay and the benefits that you get for working at Valencia or even any other organization. When we talk about total rewards, we look at workplace experiences. You can see that at the top of the screen. That truly is one of the great total rewards of working at Valencia. So when we talk about workplace experiences, it's not just it's about the coworkers that you work with and having great relationships with those coworkers, but it's also about our work that we do with the students and the impact that we have not only on the students but the community with the work that we do. So having such a positive workplace experience in that respect really is a reward. It gives us some true meaning to what we do beyond our paycheck and our benefits. When we talk about employee development, which is the next thing, because Valencia is an educational institution, we obviously value development of our employees. We'll talk a little bit more later in the slides about what some of the benefits you receive for your development. Obviously, most of us are here today to talk about our health and wellness benefits. We've got some good information to share with you, but that is another one of your total rewards. Retirement is also a great reward for being at Valencia. Being part of the Florida retirement system really allows us to, as employees, to feel a little more comfortable in with our retirement. And then also having the ability to add additional retirement savings gives us an even higher comfort level. Paid time off is incredible. I've been with Valencia for a little more than a year, so I've been through my first cycle of having spring break and winter break off as an example, and I truly can't imagine going somewhere else now and having to work during that time. That is just part of just the incredible paid time off benefits that we get. And of course, compensation. We're all here for our paychecks, so it's great getting that paycheck. But as we can see, you know, your total rewards for working at Valencia or even any other organization is a lot more than just your paycheck and your benefits. So we wanted to touch a little bit on that. Let's talk a little bit now about what's new for 2016. Obviously, we do have a new health insurance carrier and plan. We're with UnitedHealthcare, and we'll talk more in detail about the plans when I turn it over to Gloria here in a few minutes. We do have a new vision insurance carrier and plan, and that is also with UnitedHealthcare. We will have new dependent coverage levels for health, dental, and vision in 2016, and we'll talk about the differences between the two plans, or the 2 years. We do have a new employee assistance program carrier. And the great news that everybody gets excited about is that no health risk assessment is required this year to enroll. So we're excited to pass that news on to everyone as well. The other thing that, the last thing that we've added for 2016 is you're now going to have the ability to add and update your life insurance beneficiary information online through Benefit Focus. So when you go online to enroll in your benefits and you get to the life insurance portion, you will be required to enter in your beneficiary information electronically. Probably a lot of us filled out the form when we first were hired, and we've forgotten who that beneficiary is, and having it stored electronically through Benefit Focus, number one, allows you to update it during open enrollment, but then you can also update it and make changes to it at any time throughout the year, just so you know that that beneficiary information is current. So we're excited to add that feature to your enrollment this year. We have a Welcome to UnitedHealthcare packet, and we've got the list of registration, or the list of registrants that are attending. So we will actually inter-office mail out to you all that are attending the packet, so you have that information. Although we will be posting all of this online in an electronic format, it's also good for you to get that in the packet form as well. But in that packet, you'll have all kinds of great information about UnitedHealthcare, a good overview of UnitedHealthcare and the pharmacy, as well as benefit summaries for our health plans and some comparison charts of the plans and the premiums. There will be some health savings account information enclosed and some information about our dental and vision plans. So just look for that in your inter-office mail in the next few days to go through that information. And at this point, I want to turn it over to Gloria Laverne from UnitedHealthcare, who can talk with us a little bit more about the plans we have.
Sounds good. Good morning, everyone. Just like Tom said, I'm Gloria Laverne, and I am the field account manager that will be working with you all, getting you on board with UnitedHealthcare. And moving forward, my role is to make sure that you are educated on our tools and our resources so that you can navigate the system. The goal today is that you leave the call with a good understanding of what your benefits are going to be. So at the end of my portion, we will open it up for questions. And then any individual questions that you may have at a later time, you can certainly reach out to your benefits team, and we can certainly address your questions. So having said that, we'll go ahead and get started. You will have a choice of 4 different plans available to you. The rules of the game will be the same for all of the plans. So that means whatever's covered on one, it's going to be covered on the others. What they have in common is that they all have preventive care covered at 100%. So that means that any immunizations, shots, tests that are required because of your age and gender will be covered at 100% in the network. So you have to make sure that you access providers that are contracted with UnitedHealthcare. We do have a list of what those tests are. If you go to uhcpreventivecare.com, again, all you have to do is put in your age and your gender, and it will give you the list, and you can actually print it as a checklist and take it to your doctor. Most commonly, I think it's that, you're 50 years old, happy birthday, you now get a free colonoscopy, right? Makes you want to run and get that test. But just know that if you are in that preventive visit and you start complaining and you say, I've had headaches, my back is bothering me, I just don't feel right, and they evaluate you for something else other than just a checkup, they may put a diagnosis code with that visit, and when we get it at United, it's going to be processed as a sick visit if that's the diagnosis code that you have there. So I always kind of use myself as an example, being diabetic. I know diabetes is a diagnosis code that is there in the system for me. So I remind them it is my free checkup, don't use diabetes, because I will have to pay for that visit then. So the next thing we want to talk about is once you become a member, we want you to know that help is just a call, an email, or a chat away. In the back of your ID card, you will have some very important information, the member services number. So you can call member services, and we're happy to say that we have been rolling this program out throughout the year and will be fully rolled out in January, where we have 3 tier levels that can help you when you call UnitedHealthcare. You will be asked by the automated system, is this is this question about a benefit or a claim issue? And if you answer yes, you will be routed to a benefits advocate. That benefits advocate will be able to tell you how a claim was paid, if there's an issue with it, whatever information you need. So using that example of maybe your well checkup got coded with a diagnosis and now it's showing that you're responsible for, in the past, they would typically tell you, you need to reach out to your doctor, have them resubmit the claim, recode it, and we'll reprocess it for you. In the new world, they basically will say, would you like for us to outreach to your doctor and have that claim reprocessed, or ask them about reprocessing the claim? So just know that it's a little bit more, I call it, member services on steroids, more of a concierge level. The next tier that you will have available will be a health advocate. So you are diagnosed with diabetes, you've never heard of an endocrinologist. What are my choices? What do I need to know about, where to go and how my benefits will work for this particular condition? That would be a health advocate. A nurse advocate would come into play more when managing a case is needed. For instance, if you're diagnosed with cancer or you're in the process of getting a transplant, then you would talk to a nurse. And that nurse would be assigned to your household. So if anyone else in the family is having any medical issues as well, they would work with both of you. So just know that that option is, that is how our member services model works. You can actually email these folks, so you will have that information available in the back of your card. A web chat away, when you go to myuhc.com, which we'll talk a little bit more about, which is our hub where all of our information is, you can actually have a live chat with a nurse there as well. So we try to make it easy for you to pick plans that fit your needs. You're very lucky that you have 4 plan choices available. All of them will have the same network. Our network is available in 96% of all U.S. counties, and as you can see on this slide, we'll give you some of those numbers, doctors, healthcare professionals. We have over 800,000 across the country, 5,700 hospitals. So basically, you will have access to care on a national level. So even if you reside in Florida and you have a specialist that you want to see in New York or in California or in Minnesota, you can go and access care with those providers, even as long as they are in the network. One big change from going from Cigna to UnitedHealthcare. The network is all about getting providers to contract with us and agree to discounted rates. The biggest discount is usually when you make it a smaller network. So when it comes to laboratory services, we made the decision to contract with one national lab for outpatient laboratory services, and that will be LabCorp. So right now, you are able to use Quest Diagnostics to get outpatient lab work done. Come January 1st, Quest will no longer be a participating provider. Now, similar to the Walgreens and CVS's here locally, where there's one in every corner, they're across from each other, LabCorp and Quest kind of tend to be around the same area. So access would probably be the same. I don't think that should be a big issue. And lab facilities are one of those things that we either love them or we don't love them so much. So I think if you like one, you'll like the other, and if you don't like one, you may not like the other either. So just keep in mind that that is a big change. There are other facilities that are available to get lab work done, and you'll see them when you search on our site for network providers. You put in laboratory services and it will tell you. So there are other facilities other than LabCorp, but again, Quest is not contracted. To search our network, you want to go to welcometouhc.com. There, you don't need to be a member. You don't need to be registered on MyUHC to do that search, because we do want you to confirm that your doctor is participating. It will tell you to select the plan. So when you do that, you want to select Choice or Choice Plus based on the plan that you pick. So just between us, it is the same network. So Choice, Choice Plus, we don't give the doctors the choice, but it will be the same network. Some things before we get into the plans that you'll have available. You do have different terminology that I want you to be familiar with. A co-payment is a flat amount that you pay each time you see a provider or maybe fill a prescription for a particular service. So when you look at the benefit summaries that will be available to you, you will see a benefit, whether it's a physician office visit, a inpatient stay, and then next to it you'll see either a flat dollar amount or you may see a deductible in a percentage. Deductible is the amount that you pay before the carrier pays any portion of the claim. Similar to car insurance. If you get into an accident, you'll know they'll repair your car, but you'll have a deductible that you'll have to meet, so they'll deduct that from your amount. The co-insurance is the amount that you share. Typically with car insurance, hopefully they'll fix 100% of it. But if you have a cost share, it could be 75-25, 60-40, 80-20, and you'll see based on your plan design. The deductible, the co-insurance, the co-payment, everything counts now towards your out-of-pocket limit. Years ago, it used to be you paid a co-payment for an office visit or for a prescription, and you paid that till the cows came home. It didn't count towards anything. With the new Affordable Care Act, we now have it where all expenses that you pay for your medical care will count towards that out-of-pocket limit. And I think of it as maybe going into all these expenses as going into a bucket where the bucket reaches the maximum out-of-pocket limit. You pay no more. You have been you're covered at 100% at that point, and you pay nothing else for that plan year, which in your case will be January 1st through December 31st. Okay, so let's talk about the plans. What we're doing this year is something new that Valencia has introduced, and because the Affordable Care Act kind of brought in the healthcare, the marketplace, where folks can purchase health insurance at healthcare.gov. So we kind of made the plans here similar to those metal levels. You have the bronze, the silver, the gold. Bronze is going to be the plan that's going to cost the least amount to have the coverage, but you'll have the biggest amount out of your paycheck.
I'm sorry to interrupt. We have a couple of questions.
Oh, okay. I'm sorry.
Would it be, no. Would it be okay if we ask you
yes.
personally?
Perfect.
We have Ben who is asking, I'm sorry, Josie who's asking, are we using Quest Diagnostics?
We are not contracted with Quest.
Thank you. And Ben is asking, is there any coverage for outside the U.S.?
For emergencies only.
Deborah is asking, what if my doctor does her own labs?
Awesome. You can go ahead and get it done. As long as your doctor is contracted, you can have the lab work done there.
And that takes care of the very last question that we had from Josie.
Okay, sounds good. No problem. I'm on a roll. I'm sorry, guys. So we'll have the different levels when we're looking at the plans. Just like I was saying, bronze plan, it pays a minimum. So that means that it costs the least amount to have, the more it costs more to use the services. Silver is the next level of the plans. Typically, they pay aggregately about 70% of the healthcare cost, total healthcare cost, and then you have the highest level, which is the gold plan, which typically when you're out in the marketplace will cost the more to have, but least amount when you use the services. So let's look at how those relate to your plans at Valencia. You will have the Choice Bronze plan available to you, the Choice Plus Silver plan, the Choice Plus HSA Silver plan, and the Choice Plus Gold. So you'll see that all of the plans, by looking at this table, none of them require the selection of a primary care physician or referrals to get services from a specialist. Only the Choice Plus plans, because that's the little plus in the name, have out-of-network coverage. So the Choice Bronze plan has in-network benefits only. All these plans have nationwide network available, no in-pharmacy benefits. So let's look at the plans. The Bronze is the first plan that we're going to discuss. And again, you know that Valencia pays 100% of the employee premium for all of the plans. But if you are covering your dependents, you and your dependents have to be on the same plan. So the Bronze plan would be the one that would cost the least out of your paycheck, but you'd pay the most when you're using the services. Again, it has in-network benefits only. You don't have to pick a primary care doctor, and that checkup, that free checkup, is covered at 100%. So if you need to see a PCP for this plan, you will have a deductible that you have to meet. And that deductible is going to be $3,500. And then once you meet that deductible, UnitedHealthcare will pay 70% on behalf of Valencia, and you'll pay 30%. But if you notice here, PCPs do not have a copayment. A PCP is a family practice doctor, an internal medicine doctor, or a pediatrician for your children. A specialist would be anybody else. You're going to pay and meet that deductible based on the contracted rate for that provider. But because you're seeing an in-network doctor, even if the doctor charges, $200 for a visit, contracted rate is $80. $80 is what you're paid for that visit. And that $80 will go in your medical bucket and count towards your deductible. Okay? Once you, again, reach the $3,500, then we'll start paying 70%, you pay 30%. When your bucket, when your out-of-pocket reaches $6,350, you will pay the most that we expect you to pay in that plan year. Okay? The next plan is going to be your Choice Plus Silver plan. The plus in the name means that you have out-of-network benefits. So here you're going to have the best benefit if you go to a network doctor because, again, they have a contracted amount that they go by and they cannot bill you for the difference. If you see a primary care physician, you will pay $20. But if you see a specialist, you'll pay $50 or $65, depending on the specialist that you see. And let me explain how that works. It is what we call a tiered benefit. UnitedHealthcare has a program called Premium Designation Program. And what we have done is we have taken some fancy analytics and looked at claims for the different specialists and set some guidelines of care, basic care, based on a national organization for that particular specialty. So for example, endocrinology. We should have, diabetics go to the doctor every 3 months, have an A1C test, get an eye exam once a year. So those people, because they're following those guidelines and their doctor is ordering that, they're going to have better outcomes. Let's say a diabetic has to go to the hospital. Well, they get well the first time. They don't have to be readmitted. So we look at the data for those particular physicians and we rate them as premium because they're doing a good job. They're basically following the guidelines of care and their patients are having better outcomes as a result. So if you think of it like as getting a star, they kind of get a star for meeting that quality and that efficiency standard. So if you see those providers that have Tier 1 listed next to their names on the website, you will pay less because we want to encourage you utilizing those folks. But you can go to somebody that doesn't have the Tier 1 next to it and pay $65. Now, does it mean that they're not good doctors? Not necessarily. It just means that we may not have enough data to evaluate them and give them that star or that tier 1 designation. And you'll see that when you're looking, when you're doing the search. The deductible for this plan will be $1,000, and the co-insurance will be 25%. Your out-of-pocket maximum on this plan is $5,975. So if you have a hospitalization, your worst case scenario will be that. Now let's talk about really quickly about the out-of-network benefit, and that probably will be the only time I talk about it. I don't like to encourage it because you're paying more out of your pocket for having that. So you go to a doctor that's out of network, they charge the $200 for the visit. In network, we contract for $80, right? But this doctor that's not in the network is going to say, we want you to pay for the visit. We don't have to file a claim. We don't have a contract. So you pay $200. You file a claim to get reimbursed, and when we get it at United, we have to look at reasonable and customary because there's no contracted amount. So let's say reasonable and customary based on Medicare rates is $50. The difference between that $200 and that $50 that we deem reasonable is going to be your responsibility. What's going to apply towards your out-of-network deductible, it's only $50. So you paid a lot more money out of your pocket. So, you know, just beware that you do have that flexibility, but with that flexibility comes more financial responsibility. The next plan that we're going to talk about is the silver plan, but that is associated with a health savings account. And you have the HSA plans available now. I would ask for a show of hands, but I can't see your hand, so we will leave it at that. But hopefully you've heard of health savings accounts. They're basically like medical savings accounts that are set up so that you can pay for medical expenses. High deductible plans like what you see here were basically introduced like 15 years ago, and they were introduced so that they would offer a lower cost alternative of care, lower premiums, but you paid more for the services when you had the services performed. So to help you pay for the expenses, the IRS said, we'll let you set up an account where you can set that money aside, and you can put that money aside on a pre-tax basis. Don't pay taxes on it, and use it as long as you use it for qualified medical expenses. So this account will come with your opportunity to open a health savings account with Optum Bank, which is affiliated with UnitedHealthcare. And to get you started, because you will have a high deductible to meet and no co-payments under this plan, Valencia will give you $600 if you have employee-only coverage, or $1,200 if you have yourself and 1 or 2 or 5 more people covered under the plan, which is considered family. So when you go to the doctor for a sick visit, whether it's a PCP or a specialist, there is not a copay. You will have to meet a deductible of $2,000 individually if you have single coverage. But if you elected family coverage, then you'd have an individual deductible to meet of $2,600, and as a family, you'd have to meet $4,000. When those deductibles are met, UnitedHealthcare will pay 70% on behalf of Valencia. You pay 30%. Your out-of-pocket maximum under this plan is $5,775. Okay? The next plan that we have available is the Gold Plus plan, and or the Choice Plus Gold plan. Again, Choice Plus means out-of-network benefits. Gold plan offers you co-pays and deductibles as well, so it's a traditional plan. PCP copayment is $15. The specialist is the $35 and $50, tiered like the other plan. Your deductible is $500. Your co-insurance is 20%. And your maximum out-of-pocket is $5,775. So basically, when you're looking at all of these plans, look at your worst case scenario. Look at your individual situation. What do you need to have done next year? You know, we have Dan on the call. Dan, young, handsome guy who normally picks, you know, the Gold plan because Valencia paid for it at 100%. It seemed to be the best plan. But then he caught on with the fact that I never really go to the doctor. I go maybe once or twice a year, Valencia would give me $600 for picking this high deductible HSA plan. So, you know, we don't want to spread the word or say bad things about him, but he made some money on that account. So let's say maybe he used $50 out of that account this year. He's going to start 2016 with that same plan, having some money in his account, let's say $500, and then he's going to get an additional $600. The amount that Valencia contributes doesn't go away. It rolls over year after year. And as long as you use it for medical expenses, you could just use it, you know, every year, you know, for whatever, co-pays, deductibles, co-insurance. We'll talk a little bit more about the plan. Do we have any questions on the line that we need to address, or we're good?
Yeah, we actually have a couple.
Okay.
If you don't mind.
Yeah.
The first question is, how will this work for part-time employees?
I need you guys to address that one.
Great. Part-time employees are not eligible to receive benefits, including health insurance, unless they are deemed eligible per the Affordable Care Act requirements. So for a general standpoint, part-time employees are not eligible for health insurance.
Okay. The second question is, are copays counted towards the deductible or the max out-of-pocket?
The co-payments do not count towards the deductible, but they count in the out-of-pocket maximum. So they go in your medical bucket. Yes.
All right, and then there was a comment earlier about being paid during time off. This is a reference to a faculty member being paid 10 months out of the year. That we can spread out to 12 months. So technically, we don't get paid during our time off, correct? Question.
Yes, that is correct from a paid time off standpoint. It is a little bit different with faculty, yes.
Okay, great, thank you. Those are our questions so far.
Sounds good. So let's talk a little bit more about the health savings account. I want to go back to that because I think a lot of folks may not clearly understand how it works, and I want to make sure that you have a good understanding. HSA accounts are real bank accounts that will be open in your name. You can build savings for retirement because you actually are putting money aside on a pre-tax basis, and if you don't have medical expenses that you use that money for, it just rolls over year after year. The money is there when you need it, so you will get a MasterCard debit card with that account, just like your bank gives you, and you can pay at the doctor's office with that card when you're visiting the office, so when you're using the services or when you're picking up your prescription. To be eligible to open that account, you have to be in the high deductible plan. So you have to pick the Choice Plus HSA Silver plan. You cannot be covered by another health plan, so you cannot be covered under your spouse or under your parents' plan. You cannot be enrolled in Medicare, and you cannot be claimed as a dependent on someone else's tax return. Now, most tax advisors or accountants like health savings account, but I would strongly encourage you to talk to them about whether or not that is your best option or that is something that you should pursue. As I mentioned, Valencia will contribute into that account, but you're able to do it as well because that's where that tax savings comes in. So the limits, there are limits as to how much you can contribute. If you have individual coverage, you can contribute up to $3,350. If you have family coverage, you can contribute $6,750. And if you're over 55, you can put in an extra $1,000 this year. You would deduct, of course, the amount that Valencia gives you from those maximums because you can't contribute. You cannot exceed it, including an employer contribution. The next thing is Optum Bank is a member of FDIC, so those are insured funds. Only Optum Bank lets you do your banking through your website, myuhc.com or optumbank.com. So you can have online bill payment and reimbursement. What I do with my health savings account is basically I pay out of my regular checking account, and then right around this time, actually, getting ready for Christmas, I basically reimburse myself for all of those expenses that I've paid during the year. So it gives me a nice little chunk to spend, to get for Christmas. Again, like I mentioned, the MasterCard debit card will be easy to use when you're paying for your services. Next. So again, the Choice Plus Silver Plan is the one that has the HSA available with it. The qualified expenses, we do have a sheet of paper, a flyer that tells you what the eligible medical expenses are. But doctor's office visits, prescriptions, glasses, contacts, dental care, braces, chiropractic, all of those things. One of the things, too, that is really nice about the health savings account is, let's say you pick the account single, but you do have dependents. You can pay for your dependents' medical expenses, even if they're not covered under your medical plan here at Valencia. So that is an advantage. I want to spend a little bit of time talking about prescriptions, because when you're switching from one carrier to another, you will have some changes. I think when it comes to the retail pharmacy, you will find that we're contracted pretty much with all of them. So Publix, CVS, Walgreens, Winn-Dixie, Sam's Club, Walmart, all of those pharmacies are contracted with us. So come January 1st, you just give your new ID card and you're able to get your prescription. Everything will be processed through UnitedHealthcare. The way that we set up our prescriptions are based on tiers. Tier 1, 2, and 3, based on the cost and the effectiveness of a drug. So Tier 1 are going to be your generic medications, typically, but it could be any brand name drugs that cost less and are more efficient or effective, and we want to drive, that consumption. Tier 2 are going to be the ones that cost a little bit more, and Tier 4 and so on. Tier 4 are going to be your specialty pharmacy drugs, which are the ones that are injectable drugs typically that are administered by a physician. So there might be some difference because how we determine, who's on 1 or who's on 2 or 3 tier is based on the discounts that we get. The discounts could be different from one carrier to another. So it could be that you are in a Tier 3 drug right now with Cigna, but you could be moving to a Tier 1 with United, or vice versa. So you do want to look at where your drug falls now so that you are prepared come January 1st. So just like you're searching for your providers, if you go to welcometouhc.com and you select benefits, in pharmacy benefits, you are able to put in the name of the medication, and it will tell you what tier it falls under. Later on, Tom is going to tell you about a phone number that we have available, and you can call now, and they will also be able to tell you that, where the prescription falls on the tier, and if there is a lower cost alternative. 95–99% of the time, medications that have the same active ingredient, if you are on a Tier 3 drug right now and we have something else that's Tier 1 or Tier 2, your doctor may be fine switching you. It's just doctors are comfortable with what they know, and they can't keep up with who's contracted with United and who's contracted with Cigna and what the discounts are. So when if you find that there is a lower cost alternative, definitely ask your doctor because it will save you some money. Mail order is available, and the benefit of that is that instead of paying a co-payment every month for 3 months, you get the prescription written for the 90-day supply, you get 3 refills on it, and it means you're set for the year. And you pay 2 times the copay, not 3 times the copay. It is shipped to your home within 7 to 10 days, and there's no shipping or handling costs. I sound like an infomercial. But basically, you have that convenience. If you have currently a mail order prescription set up with Cigna, it will switch vendors because OptumRx is our mail order provider. So if you still have refills available, we will have an outreach program that will help you transfer those prescriptions. But on Benefit Focus, you will see that in the packet, you will have a form on how to set up a new mail order prescription. And your doctor can just call it in, or you can get the script filled out and send it in and set up a new prescription. Okay? So just remember, it's important to go ahead and look at that prescription information now.
And Dan, do we have any questions? This has completed Gloria's presentation on UnitedHealthcare. Do we have any questions for Gloria on the UnitedHealthcare?
I think so. The first question is this the same HSA account that we would use for daycare?
No. Your benefits folks are going to talk to you about the flexible spending healthcare and the flexible spending dependent care plan accounts, and those are different. The health savings account, it is open through Optout Bank, and it is a personal account. So, and that is for only medical expenses.
All right. Our next question is, will these plans be available to Valencia retirees?
Yes, these 4 plans will be available to Valencia retirees. And we'll be reaching out to those Valencia retirees in late October, early November with their plan options.
Another question, what happens to the health savings account if you no longer work for the company?
That is your money. That's a great question. You can use that money for any medical expenses. Keep in mind, or qualified medical expenses. Keep in mind, you'll have a debit card. You can actually go to Best Buy and buy a big screen TV with that money if you want. But if the IRS comes knocking, then you're going to have to prove that you spend that money. So you can use it for any qualified medical expenses even after you leave Valencia. You can only contribute into that account as long as you are enrolled in a high deductible plan. So next year, let's say you decide, for 2016, you picked the HSA. It didn't work out that well because cash flow can be an issue. 2017, you decide to go to the Gold plan, and you can pay for your copays and your deductibles with that money. You just can't put money into the account.
Okay. Another question is, if my husband is covered under a different insurance plan, but my children and I are covered under United, can I use the HSA funds for my husband?
Yes. That is a wonderful thing. It's for all of your dependents.
Okay. And looks like we have one final question. Is it correct that you must be enrolled in the Choice Plus Silver plan in order to qualify for the HSA with Valencia?
Correct. Yes.
And just to clarify, there are 2 Choice Plus Silver plans, but only one is the Choice Plus HSA Silver plan, and that is the only plan that has a health savings account attached to it.
Correct.
Okay. And with one last question, does any dependent need to be on the same plan to use the HSA?
No. As long as it's your IRS qualified dependent.
All right. And that will do it there.
Great. So we'll move on. Did you have another question?
Yes, we do have one more question.
Great.
Someone asked, can you have the flexible spending account with the Choice Plus Gold plan?
Yes, you can, and we'll actually talk about that when we get to the flexible spending account portion just in a few slides. Thank you. Great questions, everyone. So we'll talk about the opt-out plan. So you may say that you don't need Valencia's health insurance because you're enrolled in other health insurance coverage, whether it's through your spouse, through a retiree program, maybe you're retired from the military, and you don't need health insurance because you've got health insurance through another option. So what we do is we offer you the opportunity to choose the opt-out plan. And by choosing the opt-out plan, we actually had to make a few changes to it for 2016 from the previous program for those of you that may be in it currently. We did that in order for assurance that it does comply with the Affordable Care Act requirements. So the opt-out plan for 2016, the first component of it is a $500 flexible spending account that you can utilize for eligible medical, dental, and vision expenses that are not covered by your other insurance. In addition to that, you'll also receive $1,200 in opt-out funds that are going to be divided by the number of pays per year that you have. And with those $1,200 in opt-out funds, it gives you a lot of flexibility to actually spend those dollars any way you'd like. So you can choose to tax defer those opt-out funds with payroll deduction for dental, vision, or supplemental life coverage for you and your family, or you might choose to receive those dollars as a taxable income and join the YMCA through Valencia subsidized membership, which we'll talk about a little later, or invest those dollars in a retirement savings account. So we've made the opt-out plan a little more generous than last year and actually much more flexible, so it really allows you to take control and spend those dollars any way you'd like. We talk about dependents, and you'll see on the screen we've got a very long definition of dependent here at Valencia. And I'm not going to go into the details of the definition, but I did want to bring it up. And if you are planning to enroll any of your dependents in our medical, dental, vision, or supplemental life insurances, then we just request that you read through the definition of dependent. That definition is actually online in the Benefit Focus portal under medical, so that you can see, under the benefits, so that you can see exactly what that definition is. So the reason that we're asking you to just verify that your dependent meets the definition of a dependent is because we will be conducting a dependent audit in 2016. So we'll be working with a third-party administrator that will reach out to you if you do cover any dependents. So say, for instance, I'm covering my spouse under the medical plan. The third-party administrator is going to reach out to me and ask me to just verify the status of my dependent, of my spouse, just to ensure that that truly is my spouse. We are doing that really to comply with state audit practices and our insurance plan documents. So we do, Valencia's health plan does get audited annually by the state of Florida. So we just need to ensure that all the dependents on our plan meet that definition of dependent. And that definition of dependent that we saw on the previous slide is actually also written into our insurance plan documents as the definition of dependent and who is eligible to be on our plan. So we're just verifying the status of dependents in the next year, and you'll be contacted by that third-party administrator if you do have dependents on the plan for 2016. So let's talk a little bit about the rate categories, because we did make some changes for 2016. As you can see, for 2015, we had 6 different rate categories, and the biggest difference is that with the children levels and the family plus children levels, you notice that we did break it out by the number of children. And so there was a different rate category depending on the number of children, and a different premium rate for coverage for the 2 different levels. In 2016, we're actually collapsing those children levels. So now it no longer matters if you've got 1 child or 10 children on the employee and children category. You'll all be paying the same price. The same with family. There's no differentiation, again, with the number of children that you do have. The one thing that we are doing a little bit differently as well is that if you have an adult child on in your plan as a dependent, then there will be an additional added premium cost for that coverage level that includes the adult child. So not only will you be paying the premium cost for that appropriate coverage level, but you'll be paying a premium cost on top of that coverage level cost for the adult child. And our definition of an adult child is age 26 to 30 and non-disabled. Florida state law allows us to extend our medical, dental, and vision benefits for these adult children age 26 to 30 if they meet very specific criteria. And all of that specific criteria is outlined in that definition of dependent. One aspect of pulling this adult child premium cost out of the tiers is to allow that premium cost to be post-tax dollars. Per IRS regulations, that 26 to 30-year-old non-disabled adult child is not considered a dependent under IRS regulations. So we are not allowed to take those deductions on a pre-tax basis. We will have to take those deductions on a post-tax basis in order to comply with the IRS. So in addition to that, what it really allows us to do by pulling those adult child out of the children tiers is that it truly allows those children tiers to the actuarial premium rate to be based truly on children's claims costs and children's premiums. So the actual premium cost for that employee plus children rate will be lower because we are pulling out the these adult children who have adult-sized claims. Adult claims tend to cost more than children's claims. We're also thinking about an equity factor, and I do like to pick on Dan as we go through our presentations. But say, for instance, Dan has a 27-year-old spouse. That 27-year-old spouse, if Dan covers her under medical, then that is a very large cost because adding a spouse to our plan is expensive. So in addition to that, if I were to have a 27-year-old child, in the past, I could cover that adult 27-year-old child, and it would be covered under the children's rates. So even though they're both Dan's spouse and my child are the same age, incurring very similar adult-sized claims, we're paying a very different cost for the premium coverage for those two adult children. So that's another reason that we're doing that. And we'll see some more of that as we go through the rates for the plans. And we talk about the actual monthly health premiums for 2016. Valencia is going to continue to subsidize 100% of the premium costs for employee-only coverage on any of the 4 plans. So you have the option for yourself to choose any of the 4 plans that Gloria went over that we have with UnitedHealthcare. In addition to that, for the first time, we are going to be subsidizing dependent coverage as well. So you'll notice on the slide that if you do cover your spouse or domestic partner, we will be subsidizing $1,500 a year toward the coverage. If you have children on your plan, we will be subsidizing $3,000 a year. And if you add your family, which includes your spouse and children, it would be $6,000 a year that we're subsidizing. And I understand that we've got a couple of questions, so this is a good point for me to take those.
So the first question we have is, what is the difference between the employee and children level and the employee and family level?
That's a great question. So the employee and children level is truly just you adding any children under the age of 26. So it does not include spouse. The difference with the family coverage is it would include the spouse as well. So it would be spouse plus children.
And I believe we might be getting into this on the next slide, but someone asked, are employees covered by Valencia as we were before?
Yes. So by that, I'm assuming that you mean that the health plans are covered for employee-only coverage. And yes, Valencia is still going to pay 100% of the premium costs for employee-only coverage for any of the 4 plans, just as they had in the past for the 3 plans with Cigna.
Okay. Our next question is, what determines an eligible adult child and who would not fit that definition?
That's a great question. So in order for us to cover a 26 to 30-year-old adult child, that child would have to meet very specific criteria. So number 1, they would have to be either a resident of the state of Florida or be a full or part-time student outside of the state of Florida. The second criteria, and it has to meet every bullet point of the criteria. So in addition to that, they also cannot be married or cannot have any dependents of their own. The third criteria is that they are not eligible for any other health insurance through their employer, through Medicare, Medicaid, or any other type of health insurance coverage. So I think those are the 3 points, and if they meet all 3 of those points, then they are allowed to be covered under our plan as a dependent. But they must meet that definition, and you must be able to prove that dependency, that they meet that criteria when we do the dependent audit in 2016.
Okay, our final question is, what is considered a domestic partner?
A domestic partner could either be same-sex or opposite-sex partner. There is very specific criteria involving with that. You will have to fill out a domestic partner affidavit and submit it to the benefits department. There are requirements that you have shared the same address for 12 months, a minimum of 12 months, and that you are able to provide us a couple of different documentation sources that prove that sharing of the residence and sharing of living expenses for 12 months.
Also, that affidavit is located in the Benefit Focus portal under the quick links. The label should be forms and documents.
Great questions.
Those are our questions.
Super. All right. So as we look at the subsidies, we're going to move on now to the actual premiums. And I'm not going to spend a lot of time going into the detail. We actually have, the premiums have been uploaded to the Grove. If you saw the Grove article that was featured last week on the plans and the premiums, you can actually go to that Grove article now and download the rates. In addition to that, we also have the rates posted for you on the Benefit Focus portal on the 2016 Open Enrollment tab for you to view all of the different rates. But we'll also, as we send out the packets to you through inter-office mail, you'll get that hard copy of the rates in addition to that. But let's talk a little bit about the Choice Plus Gold plan. That is actually the plan that is the most similar to the OAP plan that the majority of our employees are on currently. And if we look at the total cost of that Choice Plus Gold plan for employee-only coverage, you see that it's $607 a month. These are monthly costs for you. So Valencia is paying that full $607 a month for you to have that Choice Plus Gold plan. And if we kind of step down a little bit to the Employee Plus Family, you'll see that Valencia is adding an additional $500 a month, which equals $6,000 a year, to help pay for that Employee Plus Family cost. So Valencia is chipping in $1,100 for the cost of the Employee Plus Family premium costs. The total cost of that Employee Plus Family plan under the Gold plan is $2,200, over $2,200, almost $2,300. So you can see that when you take out Valencia's cost that they're contributing toward that plan, that the employee cost is $1,170. So, and then right below that, you see what the adult children premium is. So that adult children premium, $607, would be in addition to any of the other levels. So say, for instance, I wanted to cover my spouse and I wanted to cover my 27-year-old adult child on Valencia's health plan. I would pay, under the Gold plan, I would pay $603 for my spouse coverage, but then pay $607 in addition to that for my adult child. So that would be a little over $1,200 that I would pay to cover my spouse and my adult child under the Gold plan. So as we look at the rates, although the plans are not exactly like the Cigna plans that we have currently, one thing you will notice is that if you have a spouse in the plan, or it is the family plan, if you have that currently through our Cigna plans and you're trying to compare some rates to what we have currently, although the coverage is slightly different, you will notice that if you have Employee Plus Spouse coverage for 2016 or Employee Plus Family coverage for 2016, that your rates actually increased slightly. That is because we have new plans through UnitedHealthcare that an actuary has studied, and based on and have developed the premiums based on Valencia's claims. We're dealing with our pool of employees and our pool of our employees' claims in order to come up with the premium costs for each plan that's been actuarially studied. So generally, a spouse on a plan, and it's not just in Valencia's world, it's actually in most organizations. When you add a spouse to the plan, a spouse actually incurs more dollars in claims than an employee does, and many more dollars in claims than a child does. So a spouse rate generally is a lot higher than a children's rate. And when you add a spouse to a plan, as you do in the family, it's going to raise the cost of that as well. So based on just the actuarial studies that have been done on our plans, these rates have been developed that way. One thing that you will notice, if you did have just the employee plus children coverage last year, moving into this year, because Valencia is subsidizing more of the cost for that children's level plan, you'll see that your rates actually decreased quite a bit. So it's a great benefit for your children's coverage level. Valencia did, we did strategically add more of a subsidy to that children's level plan. The main reason that we did that is if you are trying to cover your children with health insurance, you have really more limited options as far as shopping for that insurance. Adults have so many more options, and we'll get into those options that are available that children don't have when it comes to coverage. So there is a little bit more of a higher subsidy for that employee plus children rate. So we'll move into the dental portion now. And for 2016, not much has changed with our dental insurance. Valencia is still going to cover 100% of the employee-only coverage costs for your dental insurance. We're still with MetLife. We still have the same policy. The plan still covers exactly the same as it did in 2015. And you still do not need a card to go to your dentist. You just need to let them know that you have MetLife dental insurance, and they'll look you up in MetLife's system. The one thing that did change that you may notice on here is that there was an 8% rate increase on all the coverages. So Valencia did absorb that 8% rate increase for the employee-only coverage, but if you do add any dependent on the plan, you will notice that there's been an 8% rate increase on the employee cost as well. Let's talk about vision, because that is new for 2016. We do have coverage with UnitedHealthcare Vision, and it is a cardless system. You don't need a card when you go to visit an in-network provider. The one thing that we are letting folks know is that you don't want to present your UnitedHealthcare medical card when you go to your vision provider, because if you do that, then they'll tell you have no coverage. You just need to let them know, your vision provider know, that you have UnitedHealthcare Vision insurance. The vision coverage is very similar to the current plan that we have. There are some slight differences to that. If you'd like to see the details of the vision coverage before you receive your packet, you can actually go on the Benefit Focus website and see all the plan details of what's covered under vision. Right now, you have the ability to go to myuhcvision.com to check to see if your provider is within the UnitedHealthcare network. One of the differences that you will see when it comes to the national network providers is that there is some crossover as far as national network providers from Cigna to UnitedHealthcare Vision. However, there are also some national network providers that were available through Cigna that are not available through UnitedHealthcare, and vice versa. So it's best for you to check myuhcvision.com to see if your network or if your provider is in the network. And now I'm going to turn it over to Dan, who's going to talk with you about some of the other benefits that we offer.
Before that, can we just
Oh, absolutely. You have questions?
Yes.
Great.
We have two questions. One is, will a copy of this presentation be included in the inter-office mailer or be otherwise available?
That's a great question. We're actually going to post a copy of the PowerPoint presentation on the Benefit Focus website as part of your resources for 2016 open enrollment. In addition, we're going to be recording this webinar. We actually are recording this webinar to be able to post online as well. So if you'd like to go back and view it later, again, you can certainly do that. Or please let your coworkers know that if they've missed an opportunity to come to one of the tours or join in the webinar, that they can view that at their leisure. We hope to get that up in the next few days for accessibility, and definitely during open enrollment time next week.
And then also, when looking at the rate chart for premiums, the columns are all monthly columns, correct?
That is correct. They are monthly costs.
So also the Valencia cost is also a monthly cost, correct?
That is correct. It's all monthly costs. As you can see at the top here, it is monthly health premiums. Yes.
And then also, we're just another question is, this recording will be captioned as well? Yes.
I believe so. We're going to try our best to be able to do that. Yes. All right, so now I'll turn it over to Dan so he can talk with you about some of the other benefits we offer.
Okay, so as Gloria mentioned earlier, we have our healthcare flexible spending account. It's designed to assist you with your out-of-pocket medical expenses. That could be your co-pays, your deductibles, and those co-insurance amounts. Eligible expenses for reimbursement, they do include the co-pays, the co-insurances. Also, you can use it towards braces, towards any dental expenses. You can also use it for glasses or contacts, also even as well the contact solution. If you sign up for the healthcare flexible spending account, you're not eligible for the health savings account with the higher deductible, with the Choice Plus HSA Silver plan. The IRS sets a maximum contribution limit of $2,550. The 2016 limits are yet to be determined. And the main difference between a flexible spending account and a health savings account is the use it or lose it option. With flexible spending account, you set that money at the beginning of the year, and you have to use all of it or you do not get to use it again. With the HSA, you pick an amount, but if you don't use all of it at the end of the year, it does roll over. With the dependent care flexible spending account, the main thing we want to note is that this is not for dependent medical care. You would use your healthcare flexible spending account for that. This is a pre-tax benefit for dependent daycare expenses. So if, for example, your daycare center, if you're dropping your child off at a daycare center, this would be an eligible expense up to the age of 13. There's also babysitters before and after school care programs as well. It allows for reimbursement of expenses for care of a disabled spouse, parent, or child over the age of 12. For reimbursement of dependent care, the funds must be in the account prior to reimbursement. That's different from the healthcare flex spending account, where with the healthcare flex spending account, what you elect at the beginning of the year is what you can use. Then also this is a use it or lose it, a use it or lose it option. Flexible spending accounts are now set up with a debit card to use for payment. You will receive the Benny card through Shard Snyder. They are our provider of the flexible spending account. You can use that you'll get a card for medical flex spending and then also dependent care flex spending. If you do have this program right now, don't throw away your card. You will use the same card. It does have that expiration date on there, so you'll use it until that card does expire. Life insurance, the college will pay basic life insurance with the accidental death and dismemberment. death and dismemberment, it's a $25,000 policy, but as well you can use, you as well as an employee can purchase supplemental life insurance. It can be in increments between 1 to 5 times your base or contract salary, not to exceed $500,000. If you need 3 times or more, you will need to fill out an evidence of insurability. Also, if you add this benefit, you will need to do an evidence of insurability. If you add that for the 2016 year by the carrier of Minnesota Life, and that information will be located in the Benefit Focus portal on how to fill out those instructions online. The dependent spouse life insurance, there are 2 options, $10,000 or $20,000 worth of coverage, not to exceed the 50% of the employee's total coverage amount. And then also to have this, employees must have the supplemental life insurance to also have life insurance for their spouse. Then the same goes for dependent child life insurance. Those options are $5,000 to $10,000, and you only have 1 premium to provide for all of your dependent children. So it doesn't matter if you have 1 child or 10 children. It will be the same amount for the coverage that you select. Long-term disability is also another option. That's an employee-paid benefit. It pays 60% of your base monthly salary beginning on the 91st day of an eligible disability that prevents you from working. The premiums are post-tax, so any benefit you may have to receive is not taxed. As well, if you're wondering about short-term disability, it's offered through AFLAC. It can be payroll deducted. You can contact our AFLAC representative. His name is Robert Clifton at the numbers that's provided. With the short-term disability, you can add it at any point during the year, but we're just informing you again about that option. We also have our YMCA membership drive going on, and that is ongoing until October 23rd. Valencia will subsidize 15% of the costs for employee or family membership, and the joiner fees are also waived. As a member, you get the discounts to all the programs that they have going on. Again, as everybody's poked out, I'm young, so I was one of those people that participated in the youth sports. So that is a great option that they have. They have the swim lessons as well. Also, if you are a Valencia employee that has the Y membership but does not have the Valencia discount, you can let them know, and they'll go through and make that change for you. And you can go to your local YMCA location and let them know, and they'll help you get all that information taken care of. The Employee Assistance Program, it's going to be offered through Optum Behavioral Health. You get 1 to 6 face-to-face sessions with a counselor in your area. Continued visits right now through Cigna may be integrated with your UHC health plan, and it's available 24/7 to you and the members of your household, and they have different options available for legal, financial services, and then also community resources. Your retirement savings account, your tax-deferred annuities for additional retirement savings, you can choose from a variety of different 403B and mutual fund companies. That information is located in the Benefit Focus portal under the Retirement Information tab, and it is, you would invest your monies on a voluntary post or pre-tax basis. And if you have any more questions, you can give us a call for that info. The SPD funds, the Staff and Program Development Funds, they're available to full-time employees after 6 months of their employment year. You do get $1,100 a fiscal year, so from July 1st to June 30. The tuition of the employee at Valencia, you get tuition for Valencia or any other educational institution. That includes as well, you can also do professional conference registration fees. Your spouse and dependents are eligible to receive paid tuition for up to 6 credit hours per semester at Valencia. For more information on that, you can contact the Employee Development Office for more info. We also want to talk about alternate resources for dependent coverage. Starting
We actually have a couple of questions on the other benefits that we'd like to step through first before we move into that. So the question has come, does Valencia give toward the dependent FSA, or is it money you place in the account via your check?
That would be money that you would put in via your paycheck, so whatever you elect would be deducted throughout the year depending on the amount of deductions that you have.
Right. And then the next question is the YMCA benefit extended to spouses as well?
Yes, if they are on your plan or on your membership benefit, then it is also, that can also be covered.
I think those are all the questions. So we want to talk a little bit about the alternate resources that are going to be available for dependent coverage. One of the things that I like to talk about is that, Valencia, we are in the business as a college. So our goal is to obviously educate our students, and that is what we do. Unfortunately, we are not an insurance broker, so we're not able to provide you with 100 different options for health insurance. We're actually limited to offering you 4 options for you and your family coverage. But we know that those 4 plans may not meet your needs for your spouse or your dependents. So we wanted to let you be aware of some alternate resources for dependent coverage. The marketplace itself has really just opened up. It used to be about 10 years ago where you didn't have many options to cover your dependents outside of your employer. It's really changed quite significantly in the market for you to be able to shop for other health insurance. One of the main resources that you have available is healthcare.gov. And healthcare.gov is the health insurance marketplace. And as you can see here, the marketplace open enrollment doesn't begin until November 1st. And that is actually after Valencia's open enrollment ends on October 30th. But we'll talk about that date on the next slide. But you'll notice that you're going to be able to look at the 2016 plans and prices the 3rd week of October. So while we're going through our open enrollment from the 19th through the 30th, you'll be able to check out healthcare.gov and do some comparisons of the silver plans, for instance, on healthcare.gov with our silver plans to see how the coverage might be different, what the cost is on those plans versus our costs, and see if that might be a better option for your dependent coverage. Another great option for health insurance, can you go back? Sorry. Another great option for health insurance if you're looking for coverage for just your children is Florida Kid Care. Florida Kid Care has some great coverage options at a low cost. And if you do qualify based on your household income, you may be able to receive highly subsidized coverage costs. So it may be just a minimal amount per month to cover your children. So definitely that is an option for children's coverage as well. So when we talk about alternate resources, we know at Valencia that our open enrollment is October 19th through the 30th, but we also have to be cognizant of other open enrollment periods. So your spouse may have a different open enrollment period, and we know right away that healthcare.gov, the marketplace, has an open enrollment period that starts November 1st. So you may need a little bit more time to look at alternate coverage to see, for your dependents, to see how you want to cover them. So we're aware of that. We're just asking that if you are unsure about what you want to do and you might be considering seeking alternate coverage for your dependents, then the first thing we ask you to do is just reach out to us in the benefits department to discuss your options. We'll talk with you about that, and we just want a heads up to know this is what you're doing. If you're unsure, the second thing that you want to do is go ahead and enroll your dependents in Valencia insurance coverage, just to make sure that they do have some sort of coverage. Because we're going to give you until November 30th to drop your dependents' Valencia coverage if you find an alternate coverage resource for them. So you just need to be able to, if you do enroll them in your Valencia insurance coverage by October 30th, then you go out to the marketplace on November 1st to seek other coverage, and you do pick up another policy. You just need to let us know by November 30th. We will allow you to drop your dependent up to that date. We will not allow you to add any dependents after open enrollment ends. Our open enrollment ends on October 30th, but you can drop your dependents coverage. So that's just something that we're trying to communicate, trying to be more flexible with allowing you to look at alternate resources for dependent coverage. So let's talk about open enrollment for 2016. Actual online open enrollment starts this Monday, October 19th, and goes through the 30th. So you'll have 2 weeks to enroll. You will actually need to go online to the Benefit Focus portal, which is formerly known as HR in Touch, to enroll in your benefits. And even if you don't want any of Valencia's benefits, you still need to go online to decline those benefits. So when you do go online to the Benefit Focus portal, you'll see a big red button, and we'll show you that in a future slide here. But step-by-step instructions, you can download those from a link next to that enrollment button. One of the things that we're doing a little bit differently this year is we're going to have benefits computer labs at each campus to assist you. So we do have a schedule where every campus has at least one day during the 19th through the 30th where you can go to that computer lab. It'll be staffed by one of us from the benefits department, and we'll be able to assist you with any questions that you've got about the benefits. We'll be able to assist you with your actual enrollment if you need assistance with that, or if you want to get away from your desk to a quiet place to enroll, that will be a great opportunity for you as well. So those lists of computer labs and the dates, times, and locations are actually all in the Grove. So if you want to search for the article in the Grove, it has the date listed there. The other thing that we're asking you to do is go ahead and enroll early if you can. Open enrollment is from the 19th through the 30th. So even if you go in to enroll on the 19th, you still have the ability to go in after that and make any changes you want up until October 30th. So you have a lot of flexibility in dates. As long as what you've decided on is completed by the 30th, you're good to go. One of the reasons we ask you to enroll early is because those of us on the benefits team, as open enrollment is happening, we're doing audits of your enrollment data, and we're looking for red flags because we want to make sure that you're enrolling in the benefits that you need for you and your family. So, for instance, one of the red flags we might see is if you were enrolled in the Cigna OAP plan for your health insurance in 2015, but in 2016, when you went in to select your health insurance, you declined health insurance coverage. To us, that's a red flag to have health insurance coverage 1 year and not the next year. So we'll reach out to you at that point to say, hey, did you mean to do that? If you did, great. If you didn't, then we can have the ability to go in and make that change up to the 30th. But if you go in at 9 o'clock at night on the Friday the 30th and you make a mistake, and we come back in on Monday morning, there's nothing we can do about it. So we just recommend that you do try to enroll early, and then you can go back and make sure that the selections that you made were actually the selections that you wanted. And when you do go in to enroll, you will receive, once you've completed it successfully, you will receive an email notification congratulating you on completing your open enrollment. So look forward to that. Once you receive that, you know you're done. And when it comes to benefits resources, if you notice, you do have access to benefits resources through Atlas. If you go on the Employees tab, you'll see the Benefits and Wellness section under My Human Resources. And that is where you'll see a link for Benefit Focus, the Benefit Focus portal, which is formerly known as HR in Touch. And that's what you click on to go in to enroll in your benefits. And this is what will pop up. The new portal look will pop up for you. So you can see right off the bat on the right-hand side the 2016 Open Enrollment button in red. Right below that, we'll have a link set up for you to download the instructions on what you need to do to enroll. If you go onto this site now, which we certainly recommend that you do that, I don't have it in this photo here, but next to the Retirement Information tab at the top, to the right of that, will be a tab that says Open Enrollment for 2016. And it will have all the information, all kinds of documents that we've gone over today, information that you need to enroll in your benefits will all be put together under that tab for you, for your information. And then benefits news updates. We continue to post benefits news updates in the Grove, and then you get the Juice email newsletter each week. We recommend that you keep an eye out on the Grove over the coming weeks because we'll be talking more and more about open enrollment, the labs, and what you'll need to do to complete your open enrollment. But in addition, throughout the year, we post all kinds of great benefits information for you all in the Grove. So keep an eye out for those updates throughout the year. And if you need more information throughout the year, one of your primary resources you can look at is the Benefit Focus portal. That was formerly known as HR in Touch. It's available again for you 24/7 online through Atlas. And it's really your benefits information portal. So any information you want about your benefits, any details, any specifics, you can go online to the portal and find that out anytime you'd like. In addition, the benefits department has a general email address and a general phone line for you to contact us throughout the year. So now that you've met Dan and I virtually on this webinar, you may want to say, hey, I've got a question, I'm going to email Dan. But if Dan's on vacation, he's not going to answer that email. So we recommend that you contact us through that benefits email address or the benefits phone line, because if Dan's on vacation, we know that one of the other 5 of us in that department will be able to answer that phone call for you or answer that email for you and get back to you in a much faster time period. So just know that that is a resource for you year-round. And then you have campus-based HR directors to assist you with any of your needs relating to human resources. Ruth Fedor is your campus-based HR director for East School of Public Safety in Winter Park. She's actually based out of the East Campus. Liz Suarez is based out of the Osceola campus and also covers Lake Nona. There is an opening currently for the West Campus and District Office campus-based HR director, and we hope to have a selection of a candidate in the next few weeks. So look forward to that news coming up in the next few weeks. And we've completed the webinar, but before we actually finish, one of the things that I always like to do is just thank you for the service that you do for our students and each other. One of the great things about Valencia and working for Valencia is really seeing the impact that you all have on the students. I hear some great student success stories when I'm out on the campuses. And you know, all of you all get an opportunity to work with the students. You know, Dan and I don't get that opportunity, but we get to work with you. And if there's anything that we in the benefits department can do to assist you, please reach out to us. If we can make your world a little bit easier so that you can service the students a little bit better, then we definitely want to do that. We also want to remind you too, again, those open enrollment dates are October 19th through the 30th. You will need to go in and enroll. And before this is a great opportunity now if there are any final questions for us to take.
Right now we do not have any questions.
If you've got any questions for us, if you've got any questions for us, please go ahead and type them in now, and we'll answer any of those final questions that you've got.
Okay, thank you to our presenters, and thank you everyone for attending today's webinar. If you do have any other questions, please feel free to contact your benefits team. Once you leave today's webinar, you'll receive a survey on the presentation. We would appreciate it if you would complete that and provide your feedback. Thank you for joining us today, and have a great rest of your day.
Great. And do we have any further questions, Dan?
We do not.
Great, wonderful. Well, I appreciate the time that you took out today. And again, we have recorded this webinar, so please let your coworkers know that it will be available for them by next week on the Benefit Focus portal to view. Thank you.